The first line of defense definitely is primary care when you're diagnosed with that sort of stage one hypertension. If you're on three medications and your blood pressure still is not controlled, and sometimes we see people, even if they have other risk factors, they may send folks to us earlier. But typically, if you're on three meds and your blood pressure is still greater than 130/90, then that would be a good time to see a cardiologist. But if you, again, if you have family history of early MI and you're concerned stroke, then it's not a bad idea to say, hey, can I just have one referral? I've been on these medications. My blood pressure still isn't good control. I'm two or three medicines. And I just want to make sure that I'm on the optimal medicines. Then I think that's appropriate to be able to see a cardiologist, even if it's just a one-time visit or just once a year. I think it's important. Again, especially if you have risk factors of, say, uh, family members on dialysis due to high blood pressure or family members with stroke, things like that, then, because there's things that we're going to look out for as a preventative strategy that, the primary care may just add a couple things, but some things just from our practice, we know I'm not giving Black folks an ACE inhibitor. Like, I'm just not doing it. There's side effects. It's not very effective. But you still may see it in primary care. And I'm just like, what are we doing?
Sure.
No. So I think, again, depending on your risk factors, depending on your concern level, it's appropriate, especially if you've been on a couple of medications for a while and it's still not keeping your blood pressure closer to that 120/80. So, but I see a range. I see a range of folks. So, if you feel compelled, you want to let your primary know, just say, hey, I talked to a cardiologist. This is what they recommended, and